I'm very proud about the team that we have at InfuCare. Everyone is very patient focused, and I think that's very important, especially when you're dealing with a rare disease such as hemophilia or von Willebrand's disease, where not everybody really understands the intricacies. I like the fact that we do work as a team to better the health of the patient. I love working with patients that have bleeding disorders because I can associate with them through my own bleeding disorder. I feel like I can make a personal connection, understand their issues, their struggles and challenges, and be able to provide them the best personal support, one-on-one care that we can provide here at InfuCare.
The reason I like InfuCare is they're more user-friendly. As I've gotten older, infusions are more difficult. This place here is so much easier to deal with. You know, you've got factor 8, which they infuse here. I use a place in Nashville, and they were not hands-on. With InfuCare, I call Frank up, and he made sure that I get all the supplies I need to infuse. They get it shipped and I have it within a day.
InfuCare really has helped with just that extra piece. You know, we talk to the hemophilia treatment center, we get the scripts, we, find out what he's gonna need, and then we can talk to InfuCare, make sure we have our supplies, make sure that we are communicating how much product we have, how much we're gonna need in the future. I like that I can reach out to Frank and he asks how my dad's doing, if he had a fall or if he has an upcoming procedure. There's a lot of follow-up. It's a real personal aspect that is important in the process.
I remain deeply passionate about my job at InfuCare Rx because of the patient population we serve. It's a community that becomes our family. At InfuCare Rx, we really focus on the teamwork, starting with relationship building, intake coordination, pharmacy fulfillment, and it has always been our foundation at InfuCare for our success, because it truly does take a team.
At InfuCare, every patient has their own special team. So our patients have their own pharmacist, they have their own nurse case manager, they have their own infusion nurse, they also have their own intake coordinator.
The infusion suite bridges the gap by providing care in a safe, structured outpatient environment. My primary role is to ensure patient safety through thorough assessment before, during, and after the infusions. Education is also a major part of my role. I help patients understand their treatment, what to expect, and how to manage side effects at home so they feel informed and confident. I also provide emotional support to the patients. Developing therapeutic relationships help reduce anxiety and improves overall patient experience.
InfuCare's team is very unique in that we are patient-centered. We want the best for all of our patients. We want them to have the care that they need on a timely manner, and that comes together with everywhere from sales to nursing to intake to our operations staff at the pharmacy. We all work great and really well together to make that happen. At InfuCare Rx,
it takes a team.
It takes a team.
It takes a team.